Welcome to Pixarize's scene for vitamin B3 deficiency and excess, part of our series on the vitamins. If you've watched our scene on B3 or niacin biochemistry, you'd know that knives are our symbols for niacin. So it makes sense that this scene would take place at a knife emporium. Let's duck inside to peruse some knives and learn some things about niacin deficiency and excess. Alright, let's start in the foreground. See all those busted up knives? This knife store does more than just sell the niacin knives. They also fix the broken ones. This part of the image will represent niacin deficiency, symbolized by all of these deficient knives. Get it? Broken knives, or knife deficiency, for niacin deficiency. Vitamin B3 deficiency can occur from lack of vitamin B3 in the diet, or from a lack of the essential amino acid tryptophan. We mentioned in our video on B3 biochemistry that tryptophan is an important building block for the biosynthesis of niacin, carried out by the liver. Remember our hippies trippy fan? Tryptophan deficiency can occur in the setting of Hartnupp's disease, a congenital disorder that we'll cover in our next scene, and in carcinoid syndrome, which occurs when a neoplastic lesion uses tryptophan to synthesize massive amounts of serotonin, which depletes the tryptophan stores. Next, like with scurvy for vitamin C deficiency, vitamin B3 deficiency gets its own fancy disease name, pellagra. I feel bad for the other vitamin deficiencies that don't get these cool names. Pellagra is represented in our image by the pail in our knife repairman's hand, and its clinical features are defined by 3 Ds: dermatitis, dementia, and diarrhea. And they're all represented by our character here. First, check out our knife worker's hands. This guy seems to have had this job for forever, and he's got the rough, calloused hands of a knife-fixing pro. Combine those ugly hands with some of that knife polish, and you've got the perfect symbol for dermatitis and photosensitivity, which are seen in pellagra. And the rash in pellagra isn't confined to the hands. It also appears in a characteristic pattern around the neck, referred to as a broad collar or casal necklace rash. If we peep our guy's neck, we can see that he's wearing an ornamental necklace that perfectly covers his C3-C4 dermatome, the skin field covered by the casal necklace rash. I'm surprised he can afford this opulent jewelry on a knife mender's wage. Maybe it's an heirloom. Or maybe he made it. I don't know. Getting back to the knife polish that he spilled on his flaky, dermatitis-covered hands, check out how much of it he's spilled on his apron. I'm starting to wonder if he's not that much of a pro after all, since getting that much knife polish on your apron is pretty amateur. Granted, I know nothing about the knife mending game, so I'm not one to judge. Anyway, this polish-stained apron should help you remember diarrhea, the second of the 3 Ds of pellagra. Hopefully it is knife polish, and it's not actually diarrhea. Finally, look a little closer at our knife mender's face. Correct, you can't see it because he's wearing a huge demon mask. This demon mask is our recurring symbol for dementia, which is the last D in pellagra, although some people add a 4th D that stands for death, which, in addition to being kind of morbid, will happen if pellagra is left untreated. The dementia in pellagra can be accompanied by hallucinations, which is an important distinction since not all forms of dementia are accompanied by hallucinations. You'll also notice that this dementia mask has a cool, menacing tongue that our other demon masks have lacked. This red tongue represents glossitis, the final clinical feature of B3 deficiency that we have to cover. So, if a patient comes to you complaining of diarrhea, dermatitis, and a broad collar rash, and it seems like they're suffering from some sort of memory loss or reduced mental capacity with maybe hallucinations, you should think of our pellagra pail. Now, that does it for niacin knife deficiency, so let's turn our attention to the background and the sales floor. Notice how many knives are on display in this area of the image? You might say that there's an excess of knives, or an excess of niacin. This will help us remember that our sales floor will cover all of the features of niacin excess. Niacin excess is pretty much never from dietary causes. Rather, it usually occurs as a result of niacin supplementation therapy for things like dyslipidemia and hypercholesterolemia, or from over-the-counter supplement abuse. It looks like our newbie salesman is getting really uncomfortable with this scantily clad customer. I guess he forgot to put on the no shirt, no shoes, no service sign out front. And the no male or female prostitute sign. But take a look at our knife salesman's face. He's looking really embarrassed by this prostitute's behavior. Do Chippendale dancers always dress like this in public? I guess if you've got it, flaunt it. This awkward scene is meant to help us remember that in the setting of B3 excess, facial flushing occurs, which is caused by prostaglandin release, not by histamine release. That's why we have our prostitute prostaglandin here. Man, how can I apply to work in this knife store? Seems nuts. B3 binds receptors on dermal Langerhans cells, which induces the release of arachidonic acid from the cell membrane and the production of prostaglandins. This effect can be mitigated by concomitantly administering aspirin along with niacin, since aspirin inhibits prostaglandin synthesis. We've symbolized this by giving our embarrassed staff member an aspirin spear, which is effectively shooing away the prostaglandin prostitute. And you can remember this aspirin, which is chasing our prostitute prostaglandin-induced flushing away. Next, take a look at what our prostitute is doing. No, he doesn't seem to actually be here to browse the knives. He's flirtatiously tossing sugar cubes in his mouth. No one can resist this level of eroticism. Sugar cubes high up in the air should help us remember hyperglycemia, which can occur in the setting of B3 excess. The mechanism here is unclear, but it's thought to relate to niacin receptor expression on the surface of pancreatic islet cells. Finally, look down at our salesman's feet. Notice how he's not wearing any shoes? That's because he dropped a knife in his shoe and it stabbed his big toe. Classic newbie. He'll never learn. I guess he wouldn't pass the no shirt, no shoes, no service rule either. Anyway, his angry, inflamed big toe should help us remember that B3 excess can cause gout from hyperuricemia, which often presents as a swollen big toe, known as podagra. Podagra sounds a lot like pellagra, but it's not the same thing. Podagra is a swollen big toe. Niacin, or nicotinic acid, competes with uric acid for secretion transporters in the proximal tubule of the kidney, and this competition ends up raising uric acid levels in the blood. Or you can just remember that this big toe is there to represent gout. Alright, so ends our discussion of niacin excess and deficiency. Well, sort of. Our last video in this 3-part series will center around Hartnup disease, so you aren't totally done with B3 just yet. But you still deserve a reward. I think that you should go out to your local knife store and pick up one of those sweet Japanese Misono knives, or any kind of high-quality paring knife. Honestly, feel free to buy yourself any type of knife you need or want. It's completely up to you. Until next time.